So most of the male suffers from hair fall, and the major reason for this hair fall is androgenic alopecia. So what is androgenic alopecia? Androgenic alopecia is a condition where uh, alopecia or the hair fall is caused by the deposition of androgen. So in case of male we have testosterone, and this testosterone has a form which is called the dihydroxytestosterone. This dihydroxytestosterone is responsible for most of our male characteristics, is like our excessive body hair and beard and so many things. And what it does, interestingly, it deposits in our crown area of the scalp. So when it deposits in the scalp area, so it causes vasoconstriction. That means it constricts the blood vessels. So when the blood vessel is constricted, that means there is less blood going to the scalp. That means less blood and less nutrition, less oxygen is going up to the hair follicles. So what happens is that these hair follicle, because of lack of oxygen and nutrition, it weakens and eventually it dies. So that's what is causing the androgenic alopecia, and that's how it's basically working. That's why the hair fall is happening in case of men. So what are the possible treatments that we have in case of androgenic alopecia or the male type of baldness or hair fall? So currently there are few treatment modalities. Some are pharmacological and some are surgical. So in case of pharmacological substances, there are minoxidil, which is a potent vasodilator. So what we do is we put minoxidil spray in our scalp, and it increases the blood supply. That is how it counteracts the action of the dihydroxytestosterone, which is vasoconstriction. And another pharmacological agent, that is finasteride. So finasteride is a substance which actually limits the level of androgen or the dihydroxytestosterone in our body. So there is a very big side effect of finasteride. If it's not used within the limits, it causes infertility or loss of libido in case of male. So treatment modality number 3 is PRP or platelet rich plasma. It enhances the growth factor, thus it increases the hair follicle growth. And last of all of this, up to this, all of these are treatment modalities which have to be performed or be used over and over again. And if you stop using this on a continuous basis, in that case that hair fall will start again. So the permanent treatment is hair transplantation, and it's again a very costly and surgical procedure. So what is the role of cupping in case of androgenic alopecia? So what cupping does is, first of all, we put a cup in the head, in the scalp, and we first we give the negative suction, and in that negative suction the blood through the cutaneous capillaries, the blood is filtered and dihydroxytestosterone is accumulating within the subcutaneous space of the scalp. And then when we put the scratch, it's not cut, it's scratch, when we scratch the scalp, then these blood containing dihydroxytestosterone is coming out of the scalp, coming out of the blood. And this is how it is performing the action of the finasteride, that is reducing the level of dihydroxytestosterone. And again, as there is scratching or trauma is occurring in the scalp, that means it's causing inflammation, and inflammation releases histamine, it releases nitric oxide and many other substances, which eventually cause the vasodilatation. So it is the function of the minoxidil, that is vasodilatation, and increase blood circulation to the hair follicles. And this is how cupping actually does the both of the functions, that is it's increasing the blood circulation to the hair follicle, like a similar action to the minoxidil, and it's reducing the dihydrotestosterone, but it's only locally. So the side effects of finasteride will not be present in this case. So what are the treatment plan for this? So we propose, or we suggest that cupping therapy should be done 2 months apart. That means if you do a cupping therapy today, then the next therapy should be after 2 months, and within this period you will use minoxidil spray. We will combine the cupping therapy and drug treatment or pharmacological treatment, which gives the best result according to our experience. And each session has to have 12 number of cups, which will be placed on different areas of the scalp and on the back as well. And the session will cost 2000 to 3000 taka based on the cup number. For 12 cup session it's 3000 taka, and for 8 cup sessions, which will do the work, but 12 cup session is recommended. So in that case it will cost 2000 taka, and the whole session will take 1 hour and 30 minutes approximately, and MBBS doctor will consult the patient before the session, and that's how we do